This is video 2 for chapter 4. And first we have the serratus anterior, and in order to palpate this, you go on the frontal and lateral side of the chest below the 5th and 6th rib, and it's just proximal to the origin during adduction, and this is best accomplished with the glenohumeral joint flexed at 90 degrees in the same position to palpate the fibers between the lateral border of the pectoralis major and the latissimus dorsi in the axilla. And then we have the trapezius. So the trapezius upper fibers are between the occipital and the C6 and laterally to the acromion, and it's particular during elevation and extension of the head at the neck that you can feel this. And then the trapezius middle fibers is from C7 to T3, and they're laterally to the acromion process and the scapular spine, and it's particular during adduction. And then the trapezius lower fibers are from T4 to T12, and they're the medial aspect of the scapular spine, particularly during depression and adduction. And then the rhomboids are difficult to do, being that they're deep in the trapezius, but they may be palpated through it during adduction, and it's best accomplished with the subject's ipsilateral hand behind the back to relax the trapezius, and you bring the rhomboid into action when the subject lifts the hand away from the back. And the levator scapula is difficult to palpate due to it being deep in the trapezius as well, but it's best to palpate at insertion just medial to the superior angle of the scapula, particularly during slight elevation. And the last one is the pectoralis minor, and this is difficult but under the pectoralis major muscle and just inferior to the coracoid process. It's during the resisted depression, and it's enhanced by placing the subject's hand behind the back and having him or her actively lift the hand away.